Hi, my name is Leslie. I will be your nurse for today. Could I get your name and date of birth, please?
Cheryl Foley, February 19th, 1983.
Okay. And are you comfortable?
Yes.
Okay, and let's just close this up for privacy. And also, do you have any allergies?
No.
No. Okay. Can I see your hands, please? Okay. And I'm just checking for capillary refill, which can also be checked on the fingernails, and for skin turgor. Now at this moment, I'm also going to take your health history. And as she walked in, I took a look at her gait, which was normal. I'm also taking a look at her posture. And as I did her health history assessment, I assessed her speech, and she looks like she's well nourished. At this moment, we're going to take her height and weight. And we're going to take her vital signs, which we just did. Now I'm going to palpate her head, and I'm just feeling for any nodules. And right here, I'm going to go ahead and feel for her ears too. I'm feeling for any swollen lymph nodes. I'm going to go, do you have any pain here?
No.
Any pain up here?
No.
Eyes. I'm going to look at this conjunctiva, and I'm going to ask you to look down, please. Sclera. Now I'm going to test for accommodation. So I'm going to have you take a look at this pen and just follow it with your eyes. Thank you. I'm also going to do the extraocular eye movement. And I want you to follow this with your eyes, but don't move your head, please. Now I'm going to test for corneal light reflex, and I'm just going to shine this light at the tip of your nose, and I'm just going to ask you to stare ahead over my shoulder. And now I'm also going to check for peripheral eye vision, and I need you to hold this up to your eye, please. And I'm going to put my hand behind you, and you tell me when you can see it, okay?
Okay. Yes.
Okay, now we're going to move over to the next eye, and we're going to do the same thing.
Yes.
Same thing. I'm also going to take a look at your mouth. You can open wide. I'm going to shine the light. Could you say ah, please? Now, I would also be using a tongue depressor at this moment. Could I get your tongue to go up, to the left, or to the right, and to the right? Okay, thank you. I'm going to feel your throat. Could you swallow, please? Okay. And I'm also going to palpate your nose. Do you have any pain?
No.
Okay. And I'm just going to take a look. Now, could I have you just pinch one nostril closed, and could you just breathe? Okay. Now do the other one. Thank you. Now we're going to go ahead and listen to your lung sounds, and we're going to do the posterior side first. Now, we're gonna do this under her clothes, and I would inspect to see if I see anything abnormal. And I'm gonna ask you to breathe in and out every time I put the stethoscope up to your skin. Okay? we're gonna listen to the anterior side. We're gonna listen to your lungs. And I'm gonna ask you to breathe in and out. And now I would do this under her clothes. Okay, and at this moment, I'm gonna go ahead and check for tactile firmitis. I'm going to do that in the back. Now, I should have done this when I was first checking on the posterior side to not have her turn around again. Okay, I'm going to ask you to take a deep breath. And one more time. Okay. Now, I'm going to listen to her heart sound. Now I'm going to listen to the aortic valve. Now the pulmonic. I'm listening to the tricuspid valve. And now the mitral. And I'm also going to check for tactile firmitis on the anterior side. Now, I'm going to ask you to take a deep breath. And could you do that one more time, please? Thank you. Okay. And now I'm going to go ahead and have you lay back. Yeah. And now what I'm going to do is I'm just going to inspect to make sure everything looks normal, or to see if I find any abnormalities. And now I'm going to listen to her bowel sounds. Now I'm just going to palpate and you let me know if you have any pain. And my hands are cold. And I'm just palpating to see if I find anything abnormal, any lumps. Okay, thank you. And now I'm going to check for any edema. And now I'm going to check for reflexes. Now I'm just going to check her pulse, or dorsalis pedis pulse on both. Just to check that they're bilaterally even. And I'm also going to check her posterior tibial. Okay, thank you. And now I'm going to ask you to put your boots on. Let me just get out of the way. Okay. And I'm going to get you to put both of your hands apart. And I need you to, with your finger, touch your nose. And I need you to have your eyes closed. Could you do that for me, please? Thank you. And now I need you to, with both of your hands, with each finger, touch your thumb. And I also need you to do, if you could just walk, if you could walk from here to there on your heels, please. Okay, stop there. And when you come back, I want you to walk on your tiptoes. Thank you. And this time what we're gonna do, I need you to roll your hands forward. Now roll back, and I want you to go faster each time. Okay, and this concludes our physical assessment. Thank you.